Hello guys, welcome back to my channel Ages Kingdom, and in this class I am going to discuss about neonatal resuscitation. It's a very important question for 5 marks. It's the syllabus under child health nursing for BSc nursing 3rd years and 2nd year GNMs. And when we speak about neonate is usually we call it till 28 days. And this neonatal resuscitation means usually this resuscitation will takes place soon after birth. If child has not initiated spontaneous respiration, then we will plan for neonatal resuscitation. The word itself is resuscitation, means bringing back. So like a CPR, cardiopulmonary resuscitation, we will say, no? The same way here, we are bringing back the normal vital signs to the neonate or newborn baby. So there are different types of actions we will do to bring back the baby to the normal position. So that's we call it as a series of actions used to assist the newborn babies who have difficulty with making the physiological transition from intrauterine life to extrauterine life. So most of the babies face difficulty, especially in breathing and maintaining the temperature. The child cannot able to develop a spontaneous heart rate and spontaneous respiration, and in that situation we are trying to provide series of actions to bring back to the normal position, especially when child is not able to adjust with the physiological transition from the intrauterine life to extrauterine life. Then we'll see what are the indications which babies required neonatal resuscitation. So this is a 5 marks question. So usually the babies who required means is a preterm babies, the preterm delivery or delivery other than normal. Means other than normal means if the baby born with a different usage of instruments, or baby born with meconium aspiration or cord around the neck, so like that. So delivery other than normal means, and malpresentations means usually other than normal presentations, like face presentation, shoulder presentation, breech presentation, then footling presentation. So in that cases also child may born with difficulties. So in that case also neonatal resuscitation is required, and multiple pregnancy. So we call it as a twin pregnancy or triplets or quadruplets. And fetal distress means maybe it's a prolonged labor time. Mother may be facing difficulty to deliver the baby for more than 18 hours to 24 hours, and meconium aspiration, meconium straining, and severe IUGR babies, and antepartum hemorrhage means it can be like we can say baby who have mother who is having PIH, pregnancy induced hypertension. In that cases there may be a chances of separation of placenta from the uterine in uterus, and that can be leads to antepartum hemorrhage and antenatal diagnosis of any fetal abnormalities. In all these situations neonatal resuscitation is required. So I'm not going to, neonatal resuscitation is similar like CPR resuscitation. The equipment what is required is same like CPR. I'm not going to discuss in detail, but I am going to discuss very important flow chart, and it is given in DC Datta and even in Annamma Jacob and even in Parul Datta and Marlowe textbook. All this are providing this flow chart only. That means what you have to do if baby born with some abnormality, or if baby has not developed a spontaneous respiration, or baby has a Apgar score less than 7, and what you have to do. So what you have to do, first 1 minute of life soon after assessing the Apgar score, then if you assess that Apgar score is less than 7, then first 30 seconds what you have to do is clear of meconium. We have to see whether a baby born with a clear meconium or meconium aspiration is there. Is the baby crying or not? Breathing is normal or not? Good muscle tone is there or not? Color pink or not? Temperature, term gestation or not? These all things we have to check. It's nothing but Apgar score. If everything is okay, then go with routine care. You can send the baby along with the mother to the routine postnatal ward, and just we need to provide warmth and airway and dry the baby. That's it. If whatever we have mentioned in this, any one is disturbing also, what you have to do is immediately we have to provide warmth to the baby, and baby should be immediately shifted to under radiant warmer or heat atmosphere. We have to switch off the fan and switch on the AC. Temperature should be changed, and position of the baby should be properly kept, and clear the airway with mucus sucker and dry the baby, and you have to tap the baby on the back side, and that we call it as a stimulation should be given, and again reposition should be given, and oxygen administration should be given. This is all in labor room itself. Okay, this is all first 30 seconds, and after providing all these things, once again you check, evaluate respiration, heart rate and color. Is still color is in bluish discoloration or turn to pink, or what is the heart rate and what is the respiration. If heart rate is more than 100 and baby looking pink, just supportive care can be continued, like oxygen administration, providing warmth, and routine care can be continued. If after providing all these things also, if heart rate is still less than 100, then we have to give compulsory ventilation. Positive pressure ventilation should be given. And after ventilation in the next 30 seconds, still you have to check again, and after ventilation or ventilator support, if heart rate is increasing by 100 and pink looking is there, then ongoing care can be continued. But still after ventilation also, if baby heart rate is less than 60 or heart rate is more than 60, so if it is less than 60, immediately you have to continue positive pressure ventilation and administration of chest compressions. When we come to the chest compressions, the chain chest compression should be like 120 out of 120, the 90 will be compressions and 30 will be breaths. So 1:3 ratio we have to give, and again we have to check whether heart rate is less than 60 or it is increasing to 60, and more than 100 means routine care. If still less than 60 means after chest compressions, after positive pressure also, if still it is continuing, you have to administer medications. It's nothing but epinephrine. So epinephrine should be given in the intubation, along with the endotracheal intubation should be continued. So this is about resuscitation flow chart for the newborn baby. It is very clear. So approximately by 1.5 minute, the baby will come back to the normal position. That's where in Apgar score I mentioned it should be assessed in the first 1 minute of life and next 5 minutes of life. So next 1.5 minute, what we are doing is we are doing all these services. So first 30 seconds, we have to check whether it is normal or abnormal. If less than 100, then we have to go for ventilation. If more than 100, normal routine care. This is all about resuscitation flowchart. And here what they are mentioning is same thing, only newborn resuscitation algorithm or flowchart. So what are the equipment needed for resuscitation? So radiant warmer, already I said baby should be required, because the definition itself I said physiological transition of intrauterine life to extrauterine life. The changes only causing this imbalance with the Apgar score. So immediately baby should be compulsory under radiant warmer. Warm towel and blanket should be given. We call it as seasonal clothing. And resuscitation bag and mask, and like self-inflating bag and anesthetic bag, everything should be ready. Endotracheal tubes, laryngoscope, stethoscope, and oxygen source and tubings, suction source, drugs and fluids, syringes, needles, cannula, and umbilical. We have to keep ready the equipment for umbilical lines also. So this is all about equipment needed for resuscitation. And here usually in steps of resuscitation, what you have to follow is ABCDE. ABCDE. So A means airway, B means breathing, C means circulation, and D means drug administration. Defibrillation. E means we have to give emergency drugs. So this is ABCDE strategy, and in this situation we have to use normal ABCDE is now they have renamed as ABC, renamed as a CAB, that is circulation, airway and breathing. We have to try to see the establishment of circulation so that heart rate will come to the normal position. Then at the simultaneously we have to give for airway clearance, then we have to encourage for breathing. So A, B, C, D, E, and this is the normal resuscitation steps. And what are the drugs can be used for children, especially means adrenaline can be given, it stimulates the heart rate, and naloxone is a antidote for the baby, because if mother has used any sedatives during the labor time, that sedative effect can cause the baby to be depressed, or heart rate will be slow, or the muscle tone activity will be slow. So to reverse that function we have to give naloxone. And volume expanders can be given in case of acute blood loss. And when it comes to the neonatal chest compressions, already I have mentioned 3 is to 1. So if it is a heart total 120 times we want to give the chest compressions, means 90 chest compressions and 30 breaths can be given. And here you can see asystole or bradycardia less than 60, that is not increasing with the airway and ventilation, then use thumbs on lower half of the sternum. Use thumbs on the lower half of the sternum, that means one finger's width below the nipple line, and compress 1.5 to 3/4 of inches should be given, and 120 times per minute we have to give. And compression ventilation ratio is 3 is to 1. So 3 pass and give breath, 1 breath. So this is what about neonatal resuscitation. It's a very important question, and if you really like my class, please do subscribe and share. Thank you.